I'm David Shaw. I'm the CEO Administrator at Norley Hospital District. We're a 25-bed facility. However, the majority of the work we do is outpatient. Some of the specialties that we offer include general surgery, gynecology, ENT, podiatry, wound care, pain, rheumatology, general surgery, and neurology. Also, we have a fully functioning cancer center where we do chemotherapy and radiation oncology as well.
Hello, my name is Buddy Daniels. I'm the CEO of Loveless Regional Hospital in Roswell, New Mexico. We think that we give more of an expansion in terms of the experience that you'll have than any other site. Reason being, when you go out to rural areas compared to statistical large cities are very narrowed down in terms of their scope of practice, whereas a lot of our providers in rural settings, they have a very broad scope. So say for example, a general surgeon. General surgery will actually include both GI and sometimes vascular work as well. Whereas if you go to a larger city, you have a vascular surgeon, you have a general surgeon, and you have a GI physician. If you come out to rural areas like Roswell, you get to experience all of that while only saying that you're a general surgeon.
Some rotations that you'll have in Roswell, New Mexico, that I think sometimes people see our facilities as being a little more rural. I may not get as much exposure, but we are a comprehensive center. We're a comprehensive stroke center, or a primary stroke center, I apologize. We're a chest pain center with PCI. We're a level 3 trauma center. We have GI, psychiatry, urology, ENT, general surgery. So we cover the gamut.
The students from Burrell College that come here, I think one of the things that's really unique for them, so many times in a large university setting, you're really kind of have a very narrow focus. You get a broad focus here at Norley. Even our family practitioners actually work in the ER. They actually work on the floor and do hospitalist duties. And so we don't necessarily have subspecialties here that the family practice doc can refer to. They have to take care of that problem. And so they're going to see a lot of unique things here at Norley that they typically wouldn't see in a larger facility.
You get the freedom, I think, a lot too, to kind of do whatever you want. A lot of doctors say you can come in early, you can leave late, work with the nurses. So it really depends on what you want and what you come prepared to do every single day. And a lot of the times they're always really helpful and really eager to kind of watch you learn and watch you try something out for the first time. So as long as you either watch some videos, do some reading on some of the procedures beforehand, you can really get some great hands-on experience out here in Eastern.
In Eastern, or in this part of the state, we have a smaller community hospital. But the good thing about this is we don't have any other hospital or university in about 200 miles. So most of the patients that come here in the hospital is fairly complicated. It's rare for us to transfer the patient out, especially if they have a head injuries, a multi-system trauma, or cardiac bypass. But the rest of the patients stays here. So the student gets a great exposure when they come to Eastern to get variety of cases initially, starting from the basic cough and sore throat all the way to somebody who has a perforated ulcers, or who had a bad infected gallbladder, or who has a heart attack or a stroke. So all these are basically managed here. Eastern, we are basically a level 3 trauma center for last about 14 to 15 years, and they get exposure for some of those things. We do have a stroke center, we do have a chest pain center. So all these things are getting exposed as students get 1:1 direct interaction with the patients and physicians. So a lot of my students would go directly to see the patient in the emergency room, and they can evaluate the patient first and they can be part of the care from there on, taking the patient to surgery and then follow up in the office as a post-op.
you will be able to do a lot more hands-on, be a lot more exposed in our facility than you would maybe in one of the larger locations. I think the big thing I hear from a lot of the students when they look at us is, you know, I'm right there shoulder to shoulder with the doctor. And some of the larger institutions and residencies, you may have a fellow and then a resident and an attending and a couple other students and a PA student and an NP student. Here, you have direct access to the physicians.
Being in Roswell, New Mexico, you are in a very rural area, and we don't always have every specialty around. So you really learn a vast amount of medicine. And what I love is the physicians here are teach by the motto, see one, do one. So they will get you involved, they will get you hands-on. You'll be doing intubations, you will be doing central lines, you'll be placing IVs. And of course it's a comfort level for you, but if you ask and you're willing to learn and you're there, they will teach you.
And we see them progressing from third year to fourth year, and they are so confident at the end of fourth year they can go and do a lot of procedures, including central lines and intubations, and they feel very confident about what they do.
Working in the ER has been one of my favorite things, and that's actually what I'm going to pursue now, because you see just a wide variety of patient cases. My first week, I saw multiple codes, we put in central lines, I saw motor vehicle accidents, lacerations, pneumocephalus, you name it, I saw it. So that experience has just been so rewarding for me to be able to see such a vast array of clinical cases and really challenge my clinical knowledge.
I would just say this, one of the things that I think would be a great thing for our Burrell College students to know about is our medical staff here. They really love what they do, and I think being able to share that with these students is something that they really enjoy. They enjoy mentoring. We've created a culture here where our physicians have the time to do that, and they enjoy doing that, and they derive a lot of satisfaction from that. And so I think as a student, you want to go somewhere where somebody wants you there and they want to teach you. And I think that our physicians here do a great job of that.